My name is Renee. I live on Long Island with my husband. I own a business called Our Promotions, and I'm president and sole proprietor. I have 2 grown daughters and 2 incredible grandchildren. I have metastatic colorectal cancer with metastasis to my lungs and other parts of my body. It's in a late stage. I was diagnosed about a year ago in March. I had pulmonary surgery last year with good results for the surgery, clean margins as they say, but unfortunately the cancer returned. I've been on chemotherapy now since last April. Originally with the concoction or a cocktail they call Folfox, and after the surgery I was switched to another cocktail which is called Folfari. Shortly after I began chemo, I started to develop mouth sores. They weren't horrible at first. They were irritating and annoying, but I was able to ignore them. At some point, they became open sores in my mouth, blisters, and I could no longer ignore them. It prevented me from eating. It prevented me from drinking. It prevented me from talking. It prevented me from leaving the house. I was just miserable. I was walking around with a Q-tip with lidocaine on it, dabbing my mouth every few seconds. It was incredibly painful. I had literature from MSK, where I'm a patient, that said it might be a side effect. I didn't think I'd get them. A very small percentage of the population on the chemo regimen I'm on gets them. So it really wasn't a fear. It was only when they began to become severe that I couldn't live with them anymore. I tried every remedy there was. At first I tried OTC products, including things as benign as toothpaste. I went to Oragel, Orabase, other over-the-counter products. They gave me a relief that lasted maybe for 5 or 10 minutes, not longer, if that long. I then went to see a dentist. The dentist prescribed a topical solution for me. I think it was a steroid. Didn't really help. He sent me to an oral surgeon who prescribed more topical solutions. They didn't help either. My oncologist prescribed what they call magic mouthwash, which gave me some relief, but not relief that lasted for more than 15 minutes at a time. I didn't know what to do. I was miserable to myself and everybody around me. They cut back my chemo regimen because of it. By happenstance and by luck, I was introduced to MuGard. And I have to tell you, it was like a miracle for me. It changed my life. It's incredibly easy to use. And as far as I know, it's the only product of its kind on the market. The difference for me between MuGard and the other products I've tried is that nothing lasts. You could apply it 1 minute and 5 minutes later, you're in excruciating pain again. It's an oral rinse, which can be swallowed. As far as I know, it's totally non-toxic. I use it prophylactically twice a day when I'm not undergoing chemo, and I would say I rinse 4 to 5 times a day when I am undergoing chemo and for a week thereafter. It has no taste, really. My mouth is sensitive when I start developing these sores, so I do feel like, you know, the little bit of a sting of any antiseptic that you might feel, or a topical numbing agent that you might feel when you use it, but that goes away immediately and the pain is gone. As a matter of fact, one of the important issues I didn't mention is that I've been able to sleep through the night, which is incredible and important when you're battling cancer. When you're treated for cancer and you undergo chemotherapy, you are handed a whole cachet of prescriptions for nausea and other side effects. I believe that MuGard should be part of that prescription list that's handed to patients at the time they begin their chemo, so they never have to go through what I went through.